Welcome to Mobility and Joint Health Daily. I'm so glad you're here, and I want to talk to you about something that I know is silently hurting many of you right now, and that's the persistent knee pain and stiffness that's making it difficult for you to enjoy the things you love. Simple activities like walking, gardening, or even just getting up from a chair can be a real challenge when your knees are feeling stiff and sore. And I want you to know that you're not alone. Many seniors are experiencing this exact same issue. And it's not just a minor annoyance, it's a real quality of life issue. To get the most out of our channel and stay up to date on the latest tips and exercises to help you manage your joint health, be sure to hit that subscribe button and turn on notifications, because we post new videos every week. And today, we're going to be talking about a specific exercise that's been proven to relieve knee osteoarthritis pain, and that's stationary cycling. You might be thinking, how can something as simple as cycling on a stationary bike really make a difference? But trust me, the research is clear, and we're going to dive into all the details. So, if you're ready to learn more about how to alleviate your knee pain and get back to living the life you love, then keep watching. Now, let's talk about the prevalence of knee osteoarthritis and the impact it has on seniors' quality of life. It's estimated that over 30 million adults in the United States alone are living with some form of osteoarthritis, and the knee is one of the most commonly affected joints. This can lead to chronic pain, stiffness, and limited mobility, making everyday activities a real challenge. But the good news is that there are effective exercise solutions that can help manage knee osteoarthritis, and that's where stationary cycling comes in. This low-impact exercise is easy on the joints, and it's been shown to not only relieve pain, but also improve joint mobility and strength. So, let's take a closer look at how stationary cycling can benefit your knee health. One of the key benefits of stationary cycling is its low-impact nature, which makes it an ideal exercise for people with knee osteoarthritis. When you're cycling on a stationary bike, you're not putting excessive stress on your joints, which can exacerbate the condition. Instead, you're using a smooth, continuous motion to strengthen the muscles around your knee, which can help to support and stabilize the joint. And the best part is, you can start with short sessions and gradually increase the duration and intensity as you become more comfortable. For example, you might start with just 5 to 10 minutes per day, and then gradually increase to 20 to 30 minutes as you build up your endurance. The key is to listen to your body and not push yourself too hard, especially if you're just starting out. Now, let's talk about how to incorporate stationary cycling into your daily routine. The first thing you'll want to do is invest in a good quality stationary bike, one that's comfortable and easy to use. You might consider visiting a local fitness store or doing some research online to find the best option for your needs and budget. Once you have your bike, you can start with short sessions, as I mentioned earlier, and then gradually increase the duration and intensity over time. It's also a good idea to warm up before you start cycling, with some light stretching or mobility exercises to get your joints loose and ready to go. And don't forget to cool down afterwards, with some static stretches to help your muscles recover. For example, you might start with a simple leg swing, swinging one leg forward and backward, and then switching to the other leg. This can help to loosen up the muscles around your knee and reduce stiffness. As you get more comfortable with stationary cycling, you can start to mix things up and add some variety to your workout. For example, you might try incorporating some intervals, where you alternate between high and low-intensity cycling. This can help to challenge your muscles and improve your cardiovascular fitness, while also reducing the risk of boredom and plateaus. You might also consider adding some strength training exercises to your routine to target the muscles around your knee and hip. For example, you could try doing some squats or lunges, or using resistance bands to strengthen your quadriceps and hamstrings. The key is to find a routine that works for you and that you enjoy, so you'll stick with it over time. Another important thing to keep in mind when it comes to stationary cycling and knee osteoarthritis is the importance of proper form and technique. When you're cycling, you want to make sure you're using a smooth, continuous motion and that you're not putting excessive stress on your joints. This means avoiding jerky or bouncy movements, and instead using a steady, consistent pace. You might also consider working with a personal trainer or fitness coach who can help you develop a customized workout routine that meets your needs and goals. For example, they might help you identify any biomechanical issues that could be contributing to your knee pain, and then develop a plan to address those issues through exercise and stretching. Now, I want to emphasize the importance of consulting with a healthcare professional before starting any new exercise program, especially if you have a pre-existing condition like knee osteoarthritis. Your doctor or physical therapist can help you determine the best course of treatment and recommend exercises that are safe and effective for your specific needs. They can also help you develop a plan to gradually progress your workout routine, so you can avoid injury and ensure long-term success. For example, they might recommend starting with short sessions and gradually increasing the duration and intensity, or they might suggest incorporating other exercises, such as swimming or yoga, to complement your stationary cycling routine. As we wrap up today's discussion on the benefits of stationary cycling for knee osteoarthritis, I want to summarize the key takeaways. The most important thing to remember is that stationary cycling is a low-impact exercise that can help relieve pain, improve joint mobility, and strengthen the muscles around your knee. By starting with short sessions and gradually increasing the duration and intensity, you can develop a workout routine that's safe, effective, and enjoyable. And don't forget to consult with a healthcare professional before starting any new exercise program to ensure you're getting the most out of your workout and minimizing the risk of injury. In terms of specific exercises you can do on a stationary bike, there are many options to choose from. For example, you might try doing some high-intensity intervals, where you alternate between 30 seconds of high-intensity cycling and 30 seconds of rest. This can help to challenge your muscles and improve your cardiovascular fitness, while also reducing the risk of boredom and plateaus. You might also consider incorporating some strength training exercises into your routine, such as leg presses or leg extensions, to target the muscles around your knee and hip. The key is to find a routine that works for you and that you enjoy, so you'll stick with it over time. As you continue on your journey to better joint health, I want to encourage you to stay committed to your workout routine and to keep exploring new exercises and activities that bring you joy. Remember, it's all about progress, not perfection, and every small step you take towards improving your joint health is a step in the right direction. And don't forget to subscribe to our channel, Mobility and Joint Health Daily, for more tips, exercises, and advice on how to manage your joint health and live a happy, healthy life. Thank you so much for joining me today, and I hope you've learned something new and valuable about the benefits of stationary cycling for knee osteoarthritis. Remember to always consult with a healthcare professional before starting any new exercise program, and to listen to your body and not push yourself too hard, especially if you're just starting out. And don't forget to hit that subscribe button and turn on notifications, so you can stay up to date on the latest tips and exercises to help you manage your joint health. We'll see you in the next video, and until then, take care of your joints and keep on moving.